Bismillah ar-Rahman ar-Rahim. Birinium. It is a part of pelvic cavity below the pelvic diaphragm. The perineum is diamond-shaped and is bounded anteriorly by the symphysis pubis, posteriorly by the tip of the coccyx, and laterally by the ischial tuberosities. It is divided by imaginary line between the ischial tuberosities into anterior urogenital triangle and posterior anal triangle. The anatomical border of the perineum are anteriorly pubic symphysis, posterior tip of the coccyx, laterally inferior pubic rami and inferior ischial rami, and the sacrotuberous ligament. The roof, pelvic floor, and the base, skin, and the fascia. This picture shows two parts of the perineum, urogenital triangle and anal triangle, in addition to the anatomical border of the perineum. This picture shows perineal membrane which dividing the urogenital triangle into two parts, superficial perineal pouch and deep. The superficial perineal pouch, it is a potential space between the perineal membrane superiorly and superficial perineal fascia inferiorly. Contents of the urogenital superficial perineal pouch: ischio cavernous, maintain glitoral erection. Pubocavernosus contribute to the release of secretion from the Bartholin glands. Superficial transverse perineal muscles contribute to the perineal body. Bartholin glands, busy tubular bulbs, glitoris, branches of the pudendal vessels and nerve, urethra and vagina transverse this space, the superficial perineal bulge. Deep perineal bulge, it is a potential space between the deep fascia of the pelvic floor superiorly and the perineal membrane inferiorly. The contents: compressors, urethra, urethrovaginal sphincter muscles, external urethral sphincter, parts of urethra and vagina, branches of the internal pudendal artery and dorsal nerve, and the vein of the glitoris. Posterior anal triangle. The anal triangle is a posterior half of the perineum. It is bounded by the coccyx, sacrotuberous ligament, and theoretical line between the ischial tuberosities. The main contents of the anal triangle are: first, the anal aperture, the opening of the anus; second, the external anal sphincter muscle, voluntary muscles responsible for the opening and closing the anus; and ischio-anal fossa on each side. Ischio-rectal fossa or the ischio-anal fossa. The ischio-rectal fossa is a wedge-shaped space located on each side of the anal canal. The base formed by the skin. Medial wall is formed by the sloping levator ani muscle and the anal canal. Lateral wall to rod by the lower part of the obturator internus muscles covered with pelvic fascia. Ischio-rectal fossa content: first, the dense fat which supports the anal canal and allows it to distend during defecation. Second, pudendal nerve and internal pudendal vessels are embedded in the facial canal. 3. Pudendal canal in its lateral wall. 4. Inferior rectal vessels and the nerve cross the fossa to reach the anal canal. External sphincter. External sphincter can be divided into the three parts. First, subcutaneous part, which encircles the lower end of the anal canal and has no bony attachments. Second, the superficial part, which is attached to the coccyx behind and to the perineal body in front. 3. The deep part, which encircles the upper end of the anal canal and has no bony attachments. The pubo-rectalis fiber of the two levators ani muscles blend with the deep part of the external sphincter. The anorectal ring consists of internal sphincter, deep part of the external anal sphincter, and pubo-rectalis muscles. This anorectal ring can felt on the rectal examination. Male genital organs consist of vas deferens, which is a thick walled tube about 45 cm long that conveys the mature sperm from the epididymis to the ejaculatory duct and the urethra. Seminal vesicles are the two lobulated organs about 5 cm long lying on the posterior surface of the bladder. Ejaculatory ducts. Two ducts are each less 1 inch long and are formed by the union of the vas deferens and the duct of the seminal vesicles. The ejaculatory duct bears the posterior surface of the prostate and open into the prostatic part of the urethra. The function drains the seminal fluid to the prostatic urethra. Prostate is a fibromuscular glandular organ that surrounded the prostatic urethra about 3 cm long and lies between the neck of the bladder and urogenital diaphragm below. The function: prostatic secretion, thick milky fluid, contain acetic acid and acid phosphatase, which is alkaline, and help to neutralize the acidity in the vagina. A blood supply, branches of the inferior vesicle and middle rectal arteries. Thank you.